Hi friends, I am Dr. Pratap Singh Rathore. I have done the MD in Forensic Medicine and today we will continue with mechanical asphyxia. In today's video, we will discuss about self-suspension or hanging. It is by definition, it is a form of asphyxia which is caused by suspension of body by ligature which encircles the neck, constricting force being being the least part of the body, weight of the body. So here the person is usually suspended by a ligature which encircles the neck, and compression force is being because of the weight of the body. So weight of the body itself acts as a constricting force over the neck, and the person dies usually because of asphyxia. Coming to classification, based on the position of the knot. So based on the where the knot is present on the neck, the hanging is divided into two types: typical and atypical. In typical, the point of suspension is placed centrally over the occiput. So it is usually present in the neck. It is present in the backside of the nape of the neck or occipital region. It is present. That is nape of the neck. It is present. In atypical hanging, the knot is present anywhere other than the occiput. So if it is present any other than, it is called as atypical. Usually, location of the neck is near the mastoid process, that is near the angle of the mandible. It is mastoid process or angle of the mandible. It is present. Sometimes it may be also present near the front of the chin. It can also be present. That is all comes under as atypical hanging. Now, based on the degree of suspension, how much the body of the part is suspended, it may be complete hanging, where body is fully suspended. So in fully suspended, the body person is completely hanged completely without any part of the body not touching the ground. But in case of incomplete or partial, lower part of the body is touching. So here the person may be kneeling position or hanging in sleeping position, or he may be present in a kneeling or lying down or any prone position he may be present. So here the body is not completely suspended, but it is suspended in such a way that some part of the body touches the ground. So some part is completely touching the ground. Some part is touches the ground. If some part touches, like a toe also touches, it is considered as partial. Incomplete, the body is completely suspended. So here mainly in incomplete, weight of the head act as a constricting force in this case of partial hanging. Signs and symptoms in hanging. Usually the hanging is so rapid that symptoms are rarely observed, and as such it is regarded as a painless form of death. Sometimes some individuals tell about flash of light before the eyes or ringing in ears are sometimes noted. Usually respiration stops before heart, which may continue up to 10 to 15 minutes after the respiration stops. Cause of death, first and foremost, is the asphyxia. So asphyxia is a combination, is a first and foremost. This is caused because of ligature compressing the larynx and the tracheal lumen. Usually 15 kg of tension is sufficient to occlude the complete trachea. Air supply is occluded and the person usually dies because of asphyxia. Decreased oxygen in the blood, respired air, and leads to asphyxia. Next is the venous congestion. In this case, the jugular veins are blocked by ligature and there is a stoppage of blood supply to cerebral circulation. So because of venous supply is stopped, the blood which is there starts accumulating, which leads to congestion. In this case, any weight tension about 2 kg weight tension is enough to cause jugular venous compression, which leads to congestion in the brain and death. Third common cause of death is the combined part of asphyxia venous congestion, which is the commonest thing which is seen, where both the trachea is occluded as well as sometimes jugular venous is also occluded. Combined of both, which may lead to death. Next cause of death is cerebral anemia. This is caused because of compression of the arteries, mainly carotid arteries, which may get occluded by 4 to 5 kg of tension, or vertebral artery, which is enclosed near the spine, which occluded by 20 kg of tension. So because of blood supply is stopped, so there is decrease in blood supply, the cerebrum leads to anemia, that was decreased in blood reaching the brain may lead to death. Next is the reflex venous inhibition. Next cause of death is reflex venous inhibition. So this is a form of condition where, since vagus nerve is innervates most of the visceral organs, so viscera as well as GI organs, as well as in neck there are structures called like a carotid sheet, carotid organs where there is concentrated supply of nerve endings are present. So whenever this vagus nerve is stimulated, since vagus nerve stimulates it innervates viscera also, as well as it innervates the heart. So if the vagus is stimulated, or vagus is anyway because of ligature, if ligature can compress the nerves, which may cause stimulation of vagus nerve. So vagus nerve can reflexly can cause decrease in heart rate, or sometimes can also stop the heart. Next cause of death is a fracture dislocation of cervical vertebra. This is seen usually in case of judicial hanging, where the person is hanged by a sudden jerk, and which leads to breakage of C2 C3 vertebra. C2 C3 vertebra is commonly gets fractured in this case of the vertebra. Because of fracture of spinal cord, the person dies because of that. Delayed deaths in case of hanging. So sometimes the person may survive, or few minutes may not completely occluded, and the person may die because of other reasons after he survives hanging. One is the aspiration pneumonia, where the person may aspirate some of the fluids which may come out. Vomitus may get aspirated and may lead to aspiration pneumonia. There may be edema of the lungs or larynx. Infection may occur because of again because of some compression of the neck. There is vomitus may enter the respiratory tract and may get to infection. There may be infarction of the brain because of decrease in blood supply, cerebral artery occlusion. Some part of the brain get infarcted and person may die after few days to months. Or there may be hypoxic encephalopathy because of decreased blood supply. Some part of the brain may completely died and may lead to encephalopathy. Person may die. There may be also infection of the brain may lead to abscess of the brain, also one of the delayed cause of death in hanging. Complications which may arise after the person survives the episode of hanging. If the person is survives the hanging, or he may be treated. Sometimes there may some complications may arise from hanging. One is the hemiplegia, where part of the half of the part of the body may get paralyzed because of nerve damage. Nerve endings may get there may be decrease in blood supply to nerve endings on the half of our brain, and there may be hemiplegia. There may be convergence may occur again because of cerebral anemia. There may be amnesia, the person may lose some of the memories. There may be cellulitis may occur, cervical cellulitis may occur, parotitis, that is the inflammation of parotid gland may occur. There may be abscess formation, infection may also occur. These are a few complications which arises if the person survives the hanging. Fatal period, usually death is immediate if only if cases like in cervical vertebral fracture, or if heart is inhibited. It is rapid if the cause of death is asphyxia, and least rapid if coma is responsible. Usually, the period is between 3 to 5 minutes, which may extend to 5 to 8 minutes of suspension, leading to death. Now, coming to ligature. So, ligature, which is a material which is used for hanging. So, it can be used, any material can be used as for hanging. It may be rope, or it may be dupatta in females, or it can be like a towel, or anything, any rope, dupatta, anything can be dhoti, can also be used. Sari can also be used. So, anything can be used as a ligature material. So first and foremost, you have to note down whether ligature is present in situ or removed. If it is in situ, we should usually take the photograph of the ligature in situ to note down the position of the ligature with in reference to ligature mark. Then you have to note down whether what is the type of material. The type of material, as I mentioned, it may be rope, dupatta, sari, anything. Material should be enough. It has to be enough strength that it has to withhold the weight of the person. So with weight of the person has to be withheld. So it has to be seen that whether that material is has strength enough to cause the suspension, complete suspension and death. Then circumference of the noose, the complete circumference, how much it has completely encircles, whether it partially encircled, or it has completely encircled, or how much part is it occluded, that has to note it down. Based on that, the cause of death may differ. Then how much width it circumference it completes the completes the neck, it has to be noted down. Then presence of knot. The knot is very important in case of knot in ligature. The knot, if it is present in situ, we have to note the knot position. Knot position may be present in the occiput, or it may be present in the front, it may be present in the front or in the angle of mandible. So position of the knot is important. How many loops of knot is present, what type of knot is there, whether it is slip knot or a fixed knot. Usually there is it is a, usually there is a it is usually slip knot that the one. So in the slip knot, one end is more open and the other end is moving. So slip knot is usually used. Its running nose is present. In fixed knot, the end is tied up. So other end, the end is doesn't is not, the nose is not moving, and because of that it may be elongated. So usually it becomes elongated, say, if it is fixed. If it is running, it may completely encircle the neck. If ligature is in situ, it should be cut away from the knot and reconstructed by joining the cut ends with the tape of another cord. So in case if the ligature material is present in the neck, so if for example, if in this example, if knot is present, neck is present, the ligature has to be cut in a way that ligature is cut in a such a way that it is away from the knot, and afterwards it has to be reconstructed with using a gum tape. So if the knot is present, knot has to preserve to note the examine the knot correctly. Then examination of ligature mark or furrow. So ligature mark usually is left because it is a form of imprint contusion or imprint abrasion. So here the pattern of the ligature will be left on the skin, which leads to ligature mark or furrow. In ligature mark has to be examined for course, whether it is angled or straight. So in angled, it is usually seen in hanging, where it is because of hanging that it will be angled in upward fashion, and it usually becomes straight if it is the in partial hanging, or in case of strangulation it completely becomes straight, it is straight. Then width of the ligature mark, it has to be correlated with the ligature material. So it has to be correlated with the ligature material, whether width corresponds to the ligature mark or not. Then associated with any skin change or trauma, or associated with any skin trauma is present, like any abrasions are present, or if any lacerations or any type of injury are present, should be noted down. Then whether mark is with relation to thyroid cartilage, which is above the thyroid cartilage or below the thyroid cartilage. Above the thyroid cartilage, it is seen in hanging. If it is at the level or below the thyroid cartilage, it is seen in strangulation. Then pattern. So pattern has to be correlated with the pattern of the ligature. So pattern has to be seen and matched with the ligature mark. So ligature mark pattern should be correlated with the ligature material to know whether the pattern is same or not. Then neck circumference at level of furrow. So whether the mark is corresponds to ligature material, whether it completely encircles or not, that has to be seen. Then transfer of ligature material. So in a case of hanging suspension, there's chances that ligature material will be left on the mark. So ligature material, like if there is a dupatta or a sari used, the cloth material or the cloth thread will be left on the skin. So skin has to be examined to presence of this material. This material has to be correlated with the ligature mark so that it is same or not. Now coming to postmortem findings in case of self-suspension of hanging. So first and foremost is the external findings on the skin, on the body. What other findings will be seen? So since it is a form of asphyxia, there these three signs will be present. Three signs of asphyxia will be always will be present. That is, one is the petechial hemorrhages, also known as tardo spots, that is pinprick hemorrhages will be present. Then there will be cyanosis will also be seen, that is bluish discoloration of the skin because of decrease in oxygen. Then one more is the congestion of the organs. So congestion is because of the accumulation of blood supply, congestion will be present. So these three signs will be present in any case of asphyxia. So coming to in face changes, the face will be swollen and cyanosed because of decrease in oxygen, swollen because of venous congestion. So because of venous congestion or decrease in venous supply, the blood gets accumulated in the face and face gets swollen up. Because of same reason, eyeballs also get prominent eyeballs. There will be dilated pupils, and a particular feature is seen, particular sign is seen. It is called as laugh face symplectic. So in laugh face symplectic, when the person is in this case, the side where the knot is present, at that same side the eye will be open and the pupils will be dilated. So this is it is a scene in case of it is seen particularly if not is if it not presses the cervical sympathetic tube. So if the cervical sympathetic tube is if the knot presses on that, the thus at the same side the eye will remain open and the pupils will be dilated, but on the other side the eye may be closed. So this is typical hanging. It may be seen. Next sign will be some conjunctival hemorrhages may present. There may be protrusion of tongue again because of ligature mark compressing the base of the neck. The tongue may get protruded because it may push the tongue outwards. There may be bleeding in nose and ears again because of congestion. There may be bleeding from the nose and ears may occur. Lips and mucous membrane may become bluish, that is cyanosed because of decrease in oxygen. Then there is dribbling of saliva. This again occurs. This is a for sign of antemortem hanging, and this is mainly because of stimulation of salivary glands. So since salivary glands are present near the submandible, so any salivary gland may get stimulated or compressed, and saliva may be secreted from the maybe dribbled, usually at the angle of the mouth. With the angle of the mouth, saliva gets dribbled. These are the features will be seen in the face. In the neck, usually ligature mark is present. The ligature mark which is left from the ligature material. It is usually is present above the hyoid bone. Size and shape will correspond to the ligature. However, the person is hanged, it is completely hanged, that will be usually present in the above direction. Size will be similar to that of ligature. Then the direction. So direction, it is usually obliquely placed backwards and non-continuous upwards towards the point of suspension. So it is usually present obliquely, always obliquely it is present. It is non-continuous in the sense it doesn't completely encircle the neck. It is always non-continuous upwards towards the point of suspension. So the point of suspension, there is like a knot, since knot is present. So if you examine the skin, the ligature mark in the skin, it will be always it will be non-continuous. The part of the knot here, if you examine, if it knot is present at the part of the knot, ligature mark will not be present. And if you examine at the nape, it will be like an inverted V shape. Will be seen. So inverted V shape due to extension of ligature material downwards, both sides will be present. So the point of knot, ligature mark knot. So if you examine, this has a knot, this is a ligature mark. So this is ligature mark, this is the ligature. So the point where the ligature knot is present, the mark will not be present, and it will be like an inverted V mark. And it is usually always be obliquely and upwards it is present. Skin at the side, it is usually depressed, grooved, pale in color. Sometimes there is yellowish brown, dry, hard, parchment-like, that is paper-like texture will be present. Small abrasions at the edge will be seen. Neck may get prolonged due to suspension. Neck may become slender and increase in the length because of prolonged suspension. Sometimes may get elongated. Neck may also get flexed at the side of opposite to the knot. So opposite to side, the neck head may get flexed at the side of the knot, opposite to side of the neck. Next, other features. There are tattoo spots will be present. It is always it will be present, as I mentioned, it is a sign of asphyxia. So it is present in case of in forehead, eyelids, under the conjunctiva and near temple. So this is usually the pinpoint hemorrhages which is present in the body. There will be cyanosis of fingernails, that is bluish discoloration will be present. Purple color postmortem staining, that is PM staining, which is seen in the dependent part of the body. So it is usually present in the hand. So in hand, it is present in the upper part like a glove, in the lower part of the upper regions, and in the legs, it is usually present in the up to the below the knee. So it is called as a glove and stocking postmortem PM staining. So it will look like a glove, and in the legs it will look like a stocking. Glove and stocking type of PM staining is seen. Hands are usually clenched. In males, sometimes there may be penile turgidity may occur, and involuntary discharge of semen may also seen. Involuntary discharge of fecal material and urine may also be present. Now coming to internal findings, dissection of the body. So in case of hanging, usually the modified Y-shaped incision is taken. So in modified Y-shaped incision, it will usually extends from the back of neck, back of the ears, and below the at the point of clavicle and along the sternum and below the like that. So this is a modified Y-shaped incision is usually taken to prevent the damage to the ligature mark. When dissecting the neck, there is subcutaneous tissue underneath the ligature mark. It will be dry, white, firm, and glistening. Muscles, platysma muscles, sternocleidomastoid muscles may show hemorrhages and sometimes may get also ruptured. Hyoid bone may be fractured in some cases. The carotid intimate tears may be seen in arteries. Vertebral artery may also be injured. Larynx and trachea are congested or obstructed and congested. Fracture of superior hyaline of larynx may also be present. Dissection of other organs in lungs. Usually the lungs are congested, distended, emphysematous with plenty of tardo spas subpleural present. So plenty of tardo spas will be present. It will be congested. Brain is also congested, which may also show multiple pinpoint hemorrhages, that is tardo spas. Viscera may show abdominal organs are all are congested. So that is liver, spleen, all kidney will all be congested. Blood will be fluid and purplish in color. These are the internal findings. Now coming to medical aspects of hanging. First is the postmortem hanging. So this is a form of done when conceal and mislead a homicide case as a suicidal hanging. So this is usually done when the person is killed and is suspended afterwards. That is postmortem hanging suspension is done to conceal that the person was killed. In this case, you have to know whether there is signs of dragging of the person is present. Then there is chances that if the person has been hanged in on the beam or branch of the tree where the person is hanged, there is evidence of rope may show that is below upwards, it may be dragged. So since the rope will be dragged from below upwards, so at the beam it will be the mark will be from below upwards may be present. Usually when the person is hanging himself, it usually throws the rope from above up below and ties. That will not be present. Next medical aspect is the suicidal hanging. This is the commonest mode of committing the suicide, and there is no age bar for committing suicide. If the person has been partially hanged, it is almost diagnostic of suicidal hanging. In these cases, there is usually the previous attempt of suicide attempts may be present. Usually, suicide note is also present. Homicide hanging is very rare. It is impossible if the person is conscious to hang. Usually, healthy adults, if he may be made unconscious or he may be given alcohol or drugs and hanged afterwards to stimulate that as a homicide hanging. One may suspect homicide by virtue of injuries on the victim, a presence of some injuries like contusions on the arms when the person is being tried to constrain, or sometimes presence of abrasions or any part of the body on the scene of crime. The scene of crime may be disturbed, which may look like the person may be alive, maybe struggled before death. Accidental hanging, which is seen many times in case of infants. There is umbilical cord in the neck, in the uterus. The umbilical may be tied around the neck, and there may be hanging may occur. Or infants may get hanged if accidentally because of some pacifiers, or if some bed sheets are caught around the neck, and if the child falls off from the bed and may get hanged. In children's, while playing with lasso or any type of rope or any type of ligature material, the children may play with it, and when he falls or fell down by the bed, he may get accidentally hanged. In adults, there is a condition called as sexual asphyxia, where the usually it is seen in adolescents or the children who are undergoing puberty in males, commonly seen in puberty male, where they usually under compress the neck by any material, which causes some form of as the compression increases, decrease in oxygen causes some form of arousal in them. So they usually undergo this exercise regularly, and by mistake, accidentally, the compression may increase and the person may die because of asphyxia. This is called, it is seen in as a form of sexual asphyxia. Next medical importance is the lynching. So lynching is a form of homicidal hanging. In this case, a suspect or the suspect of a crime or accused of a crime or enemy is overpowered by several persons acting jointly or illegally and hung him by means of rope from a tree or some similar object. It is presently used as a type of killing of a social offender publicly by a mob. So lynching is mainly done by a group of people who are angry for some particular person because he has committed a crime. They hang him publicly as a form of message towards the society. Next, medical importance is judicial hanging. It is a form of capital punishment which is done given in India. In this, ligature is looped around the neck and knot is placed below the chin or below the auricle, and the person is dropped at least up to his height, usually 5 to 7 feet, and the hanging is complete. So in this case, as the person is suddenly fell down, the neck causes forcefully jerky impact, which causes the fracture of the cervical column. The fracture is usually at the level of C2, C3 vertebra, rarely C3, C4 vertebra, and this is called as a hangman fracture. And because of this fracture, there is stretching of cervical spinal cord, and the person dies because of fracture, because of this. Now, difficulties in diagnosis of death from hanging. So there are certain conditions where it will be difficult whether the person was died because of hanging or because of other conditions. One common first is the example is a ligature running around the neck. So usually, as I mentioned, the ligature in hanging is usually oblique, and one part of the part is not completely not present. So if the completely it encircles the neck, it becomes difficult whether the person was hanged or not. It may occur if the victim may be killed first by strangulation and then hanged by stimulate the suicide hanging, which may be seen mainly in case of strangulation. It may conceal the way postmortem suspension may be done. Presence of two ligature mark. If there is a presence of two ligature mark may occur when the person may be antemortem by hanging case may be present, but after a few minutes of hanging, there may be the ligature may be slipped further down, producing second ligature mark. So once the person is hanged, and after a few minutes, it may again be dropped, and there may be second ligature mark may be also present. Nail marks on the neck. So nail marks usually indicates that struggle mark is present. So it may also be occur in normal in suicidal hanging also. So possibilities are that the victim may be tried to get after hang may make efforts to release the ligature on the neck with his fingers, which may lead to nail marks may be seen. Then faint ligature mark. So in some cases, if the person had died, even though the person had died because of hanging, the ligature mark not be evident. It may be because of skin complexion. It may not be completely evident. Then injuries on the body. The victim may be inducing hanging might have got injured himself sometimes while trying to get hanged himself while moving the rope or while moving the table, or sometimes he may get also injured, which may be mistaken for like a homicidal condition. So in these conditions, it is very difficult to diagnose whether the person was hanged or it may be because of whether the person was homicidally killed. These are my references. Thank you.